have you already noticed if there is an increase in the relationship between COVID vaccination and sudden deaths in some countries? Or
well, thanks for having me on the program. You know, as introduced, I'm a practicing internist and cardiologist, and I would point out that we know the vaccine in published studies circulates in the bloodstream for at least a month. And in athletes, they draw more myocardial blood flow, more blood flow to the heart. And the spike protein from the vaccine is found in the heart muscle. So we know from the peer-reviewed scientific studies that the vaccine is damaging the heart.
But there has been an argument, okay, saying that there has been an increase in myocarditis and pericarditis after the use of this vaccine. And it has already been admitted even by some pharmaceutical entities. Is this issue debated in the United States? Because here in Italy, they still tend to to try to make it seem that they're really rare conditions and that it's nothing to be, or to worry about. Is there a debate over these heart diseases that are happening, and how dangerous are these if they're debated?
I'm seeing young people in my practice with myocarditis or heart damage on a daily basis. Now, there's over 200 peer-reviewed publications on fatal and non-fatal cases of myocarditis. It's beyond debate. The vaccines are clearly causing heart damage, and that's leading to death. There appears to be a willful blindness to myocarditis by major hospitals, healthcare systems, medical schools, and this is concerning because the peer-reviewed literature continues to mount. The death count appears to be mounting. And we should have seminars, we should have grand rounds and symposia on vaccine-induced myocarditis so we can learn how to better diagnose it and treat it.
Does non-diagnosed myocarditis, may it cause a sudden death?
It's very clear that myocarditis can lead to sudden death. A report by Gill and colleagues, as one of many papers, found 2 boys, aged 16 and 17, dead in their beds 3 and 4 days after taking the Pfizer vaccine. And an autopsy was performed, and this was published in Archives of Pathology. The vaccine clearly causes fatal myocarditis.
So for how long one is under risk of developing a myocarditis or another cardiovascular disease after taking this vaccine? For how long there's this risk to develop one? Just after the vaccine, or is it forever? Definitely.
We now understand that the peak age is between 18 and 24 years old, and 90% are boys or men. Now, the age range can extend up into the 60s and 70s as a long tail, but it's primarily of college age, university age young men. It most frequently happens after shot number two, and then there is an additional risk with shot number 3, as published by Rose and myself. Of the cases that occur, about half are recognized with chest pain and other symptoms. Half are silent. And then when this happens and it's recognized, it's usually within 30 days. The great concern, if it's not recognized, that there's heart damage, and then several months later, a cardiac arrest that occurs typically during sports activity or during sleep. Those are the 2 major times when the cardiac arrest occurs in young people.